Welcome to Healing Through Dentistry podcast,
where we redefine health, wellness, and the power of your smile.
We're your hosts,
Hannah
and Eva, twin sisters, qualified dentists and medical doctors.
This is more than a dental podcast.
It's a journey into profound connection between oral health and whole body healing.
Through personal stories, inspiring client transformations, and expert insights,
we explore how dentistry can ignite energy, relieve chronic pain, and transform lives.
Get ready to discover the extraordinary ways your smile can heal, inside and out.
Let's begin. Welcome to next episode, where we are talking about gums, prevention, flossing, brushing, emotions, and nutrition.
Yeah, everything to do with the dental hygiene.
And please hear the previous episode. We were touching on this topic. So we will unroll. We will start talking about what the best approach was, the protocol of cleaning, brushing our teeth, what works, what we see beautiful results with.
Maybe before we start about the dental hygiene protocol, what we see works for us and our clients, I would summarize what can influence the dental hygiene. It's definitely not only the brush and the flossing you might have heard many times in your lives. It is also about emotions, certain emotions. It is about stress levels. It is about nutrition. It is about toxic stuff you have in your mouth, meaning amalgams, heavy metals. It is also about
fear and toxic emotions, forgiveness, and basically I would call it toxic emotions.
Right. Okay. So let's begin dental hygiene. So I
think I would say it's our passion. So how it starts, we always wanted to create a clinic where we are big on prevention. And we wanted to create something which is, you come and you would manage more things in one session, So kind of when you multitask in your life, we wanted to multitask in our clinic. So we combine certain things within dental hygiene. So we would divide the conversation about the dental hygiene and what works there. And then we will talk about what to do at home. What do you want to start with, Anna?
I think in the surgery.
So what works in our clinic, we are combining dental hygiene with deep relaxation and ozone therapy, oxygen therapy, which is we're trying to give the body the nutrients for the body to heal, but not only the physical level, but also spiritual or emotional level, because we know that certain frequencies, they are bringing us into parasympatheticus, which is the mode when we are relaxed, when we are digesting. It's a relaxing mode. And the neuroactivity is in alpha theta mode. And we'd like to actually help or bring that to our clients in order for them to heal nicely within the session. So we use a headset, which is a combination of alpha theta waves. And then the first part is dental clean with ultrasound.
I would maybe stop there, Eva. I would just, before we just, talk about the extras, which will help a body to heal, the whole body, not just only gums and teeth. And let's just talk about just like the pure, simple hygiene people probably know, which means dental cleaning, how often, why that often.
Okay, yes. So
what's the regimen?
Yeah, so that's the ultrasound cleaning, which is like everywhere in the world. If you come to hygienists, they will use ultrasound and scalers. So you're trying to remove the buildup, which is the mineralized plaque buildup
Bacteria
created by the time. Also, depending on what is your nutrition and how often. Well, we see on our clients that, it's very individual, but basically for most of us, is we do recommend 4 times a year.
I do see our hygienist every 3 months. And there were actually times, not long time ago, I used to see her even more frequently because I used to have braces and I needed more frequent care. But in general, I'd say 80-20, rule. That 80% of our clients, we recommend them to see our hygienist every 3 months. On a regular basis.
And why is that? Because we like to create alkaline background for in order to have great microbiome, because we love our bacteria, but we love them in a balance. And if we are an alkaline background, it means that the good ones, they remain, and the bad ones, which are acidic driven, they would go.
And so what causes the acidity in the mouth? Obviously the plaque and the buildup. So when you do have your teeth free of plaque and free of buildup, then there's less likely it's going to be very acidic environment 24/7. And I am aware of how complex the mouth is and how every single tooth is different. So even though I've had braces, I know there are spaces which I cannot brush 100%. Even though I do brush sometimes more than twice a day, I floss once a day, and still I know that there are places where I need some attention. And that's what I explain to my clients as well. It can be even, 80, 90% of their teeth. Okay, but there may be like few spots, and it can be at the back when they can't reach because of the anatomy and the curves in their mouth, or some teeth are rotated to the right or to the left, or they are out of the arch, which means you can't reach them, or when you're brushing, you kind of, they're like in the shadow, so you don't brush them properly. And this is the reasons why we need an extra care. It's also when people do have crowns, implants, braces. These are the extra, times when you probably need to see hygienists even more frequently.
And I wanted to add something which was important. I just lost the track, but let me just think.
Microbiome? Or like what? What else? Like you started with like ultrasonic. So what it is consisted from? Like we take it as a normal thing, and as maybe everyone's not aware of what was happening in the hygienes. Maybe some people have never been to see one. So what in our clinic, what our hygienist use, first of all, she used ultrasonic device, which can vibrates and just, like kind of, if I just say it really easily, it breaks the buildup and helps it to remove it out. Then what she uses, and it's really, really good, and I call it like a power jet, because it's like a high pressure water and a special, like a salt-based powder, which helps to clean your teeth. It is beautiful because it does get microscopically in your, teeth structure. Yeah, it kind of whitens them, right?
It reaches the inner spaces of the teeth, because the teeth are created as a tubes. The crystal of the teeth is like made of tubules, and you're basically with the little molecule, you're getting into the tubes and you're mechanically clearing them. And that's how I explain also bleaching, because if you have bleaching, the gel really gets to the same place, inner parts of the teeth, but chemically breaks the bonds of pigments. But I know what I wanted to say, because we used the word plaque many times, and I wanted to say, what's plaque?
What's plaque?
So plaque is like a film of bacteria. So that's what I wanted to say, because you were talking many times about plaque. So it's biofilm, it's film of bacteria,
which forms on your teeth and you don't brush them.
But very quickly, it's natural. You have to have a biofilm, but you need to break it as well. Otherwise, if you don't break it with brushing, then you would develop, it would change, it hardens, and it goes into calculus.
Exactly.
As you see the kettle in your kitchen, so it's the same thing.
Yes. Yeah, so we're using the ultrasonic, we're using the airflow, which is the water blaster, and we're using a special, like a Profi jet, which just cleans. It's like a special brush, which means...
But I think it's important to talk about extras now, because we were touching on sound therapy, but also ozone therapy and oxygen therapy. The ozone therapy for me, it's a transport
therapy.
And IV therapy. For me, ozone therapy, it was changer, like game changer. And for me, just beautiful to see results that quickly, because you hear terrible stories like, some clients, they go to a specialist who is called periodontal specialist, and they are prescribed combinations of 3 antibiotics. And
you don't want that.
And either they take them or maybe they don't take them, and they are looking for other specialists who may approach this issue differently. And we do approach it differently, because we have beautiful results with ozone. We use ozone because, one, And there's two things. One, they stress pathogens and within a layer of 3 millimeters.
On cellular level.
On cellular level. But second, and that's the biggest part, it does stimulate mitochondria. And the mitochondria, I tell always clients, it's like a energy motor for all the cells. And it activates the creation of new tissues. So we see beautifully, bone growth, gum growth, the soft tissues, hard tissues. Because not long ago, especially surgeons, they were saying, there is no way that bone grows back. And it's not true. You only need to have very beautifully area cleaned and with no inflammation, the source of inflammation, which is the bacteria, which are creating acidic toxins. So we see beautifully how the teeth get stronger because they have support, more bone cells around and healthy tissues.
And not only we see it, our hygienist sees that as well. I remember a few years back when we bought another device and we decided that we're just going to use it on a daily basis in a hygiene field. They don't want to,
take it out of them hands because they love it. They love the results, very quick results.
And
it speeds up the process of healing the gums.
Yeah, we see what it used to be healed in 9 months and it's healed in 3 months.
And with the oxygen, I feel that's the power of medicine, future medicine, even ozone, because that's oxygen as well. So it does bring you sort of nutrition for the cells, molecular level, and you are healing within on molecular level. So your body feels recovered. We usually give the oxygen to pregnant moms and moms to be, and they are so perceptive, they rest so well. So we do recommend everybody to use it.
Everyone really, and you probably hear it from every corner. And again, for me, it's a common sense. Oxygen is the
the
motor for everything. And you probably hear about hyperbaric chambers and about ozone. And, even if we look at sportsmen who go and train in a higher altitudes, that's it. There's a different accumulation of oxygen in the body, and it gives them more oxygen and red cells, and they function much better. So that's exactly why we like to use oxygen as well with our treatments, because overall, well-being is being lifted up, is being,
elevated.
Yeah. Exactly. That's the word.
This was the procedure at, professional level, but
what about supplements and IVs? Yeah, that's another, I think that's another
At
part.
The professional level, it's IV, which is you can't do it yourself at home, so you can supplement. But IVs are powerful because it's instant, and there is more and more people demanding IVs because they really see beautiful results on themselves, which is always
therapy for people who don't know. IV, intravenous therapy for gums especially love vitamin C. What doesn't love vitamin C, right? So that's powerful as well. And all the supplements, if not in an IV form, in an intravenous form, then supplements normally when you just take them orally. And we do recommend collagen with vitamin C. But also, again, because we know that
amino acids, that's what we drink every morning.
Yes.
For repair.
That's what I want to just say. I can just add on so many more because everything goes hand in hand. You've got amino acids, you've got B complex, you've got omegas, you've got, even probiotics and prebiotics, proteins. Yeah. Because that's what all just supports our detoxification. Because when we're talking about gum disease, that is inflammation. And the inflammation in general, it doesn't really matter if it is a gum inflammation or inflammation coming up from the response of the body when you've got the metal fillings in. It all ends up in the same reaction for the body. It's the immune system reaction to it, right? So what is very important to do, the detoxification. And, the probiotics, minerals, and vitamins supports the clearing our liver, our gut, and, our...
Yeah, and your mind, because, if you clear your liver and gut, then, it's the gut-brain axis. It's just you feel better. People, when they see a little change, they keep going, and we have beautiful results on every level.
Yeah.
But, I feel like people, they always ask about home. What do I do at home? So we would just recommend what works for our clients.
And us in general,
And us.
like two of us.
Yeah, but we see it on our clients. But for me, I mean, I do it years and it's just like,
so we
didn't have any issues since we were 10, right? So we kind of sorted it quickly.
That's because we do not only brush, but we floss. And I don't think we stressed it here enough yet. What is very, very interesting, and that's probably was the secret of not having decays as well on this physical level, is to be using a floss. So to be flossing interdental brush, interdental spaces. On the other hand, you know, if we lived 150 years ago, we probably didn't need a floss because the nutrition was totally different. There was no processed food, no sugar, no flour, and basically only like what we name now as in a healthy food. It was meat and vegetable, and you didn't need any.
No, you didn't need, and
that's
I would remind people to read a book from Weston Price, and this is actually, he studied cultures 100 years ago, and he was actually looking at cultures who didn't adapt the Western food, and they had no cavities, but they didn't have small jaws and
metabolic disease. So it's not about the mouth. Obviously, we're dentists, so we're always all about, you know, like mouth focused on that still, even though holistic. But like what Weston Price, who was a Canadian dentist, who decided to just travel the world and see the cultures in Australia, Aborigines, and in South America and all over the world. And he was like putting dots together and seeing, okay, these guys do not have a processed food, and actually they do not have cavities, but they also do not have a metabolic disease. That is quite interesting, and I think that is a great book. If you just mentioned, I would recommend to read that as well, Weston Price, and it's called Physical Degeneration. That's a great resource. So that was nutrition and supplementation.
And what do we do at home? So I would add, like, we had teeth brushing, we had a dental floss, interdental spaces. I would add tongue scraper, ideally copper based, because, you know, all days we knew, you know, you may know that your grandmas, they had copper pens, and it's because it's antibacterial.
Cooked in it,
So we're coming back to basics, and I feel I would like to again talk about mouth rinses, which I love and see huge results when people, they start rinsing with salt water, or they use toothpaste based on salt, because it does alkaline the background of the mouth, and the good bacteria, they remain. The bad ones, they disappear because they don't thrive on alkaline background. So that's very powerful. And one more thing which I would add is oil pulling, which is
an old Ayurvedic technique, thousands and thousand years old, which is, and I like it to do it sometimes when usually it's a coconut oil, right? So you just put 1 spoon of coconut oil in the morning in your mouth, and we do recommend 5 to 15 minutes. You can, you know, swish it in your mouth, and what the coconut can do, it powerfully takes all the toxins from your mouth and, you know, put them into the oil, and then you spit the oil out. Like, be careful not to spit the oil in a sink, because it would harden it would just block
your sink.
Your sink. So just be sure that you spit it into the bin, right? That's important.
The powerful thing about that is also that it's calming you on neural level. Because you're calming your parasympathetic, because it's like when we were little, it's similar when we were gargling. Which is like you have vagus in here, and it just really relaxes you. So just, you know, do it. Go back to basics, go to shower.
But also when it does, I like that actually, because another thing it does, it strengthens the muscles around here. So it's like an exercise for a TMJ, for your temporomandibular joint. So it also...
And it relaxes emotions, because you open your mouth and lots of emotion is stored within your jaw. So there is a nice exercise to open your mouth. Put your tongue away, like if you imagine the New Zealand rugby players, Richie McCaw.
Haka.
So haka. So you do the haka, and you're really releasing the emotions, and that's why they were so powerful. They're still very powerful in New Zealand rugby.
I just seen, did you see that ever on Instagram? That was, I don't know what politicians, but they were just like a new politician in a place in New Zealand. No, or like Navy Guard or like Army Guard. And they were just doing haka together. And it was just, and they were saying it's the first lady who is like in charge, and they were just doing the haka and the ceremony.
Yeah, beautiful.
And I thought it was impressive. So they did it on TV.
I love to say that because it's all connected. So it's nothing is, it's just not the sign of you open your mouth and put your tongue up or, away, but it's also connected with releasing some emotions and getting ready for
a lot, right? When
getting ready for a great match and for a great fight.
If you never see it, just see it. It is actually the impression of their face and the noise they're doing. It's just scary. And that's, like you're saying.
It is powerful. And the other team is just standing and looking at that. I mean, yeah. So I think
what we are going to be sharing next time, because it's much broader topic, is what to space, because that's probably one of the most questioned question.
We will. And before we stop this episode, I would like to talk about wisdom teeth inflammation. Only one story to end it up, because that's something which I would like you to hear. And then the next episode would be about toothpaste. Yes. So lots of clients, they come to our dental clinic and they have heart issues, palpitations, arrhythmia, and they're young, or they're
Anxiety.
not young, or they're super young. So any ages.
But also not only palpitation, but
but I would like to just talk about heart, because we know that the wisdom teeth are on meridian of heart and intestine, small intestine. So there will be other issues when we would not approach the inflammation around the wisdom teeth. But just lots of clients, they have impacted wisdom teeth. Basically, the teeth are halfway in the mouth and halfway in the jaw. And years and years and years, the body is super smart, and it you don't even know that there is a chronic inflammation, because your body is super good. It will always protect you. But you're taking your energy on that meridian level, which is connected with the heart and intestine. And we have many clients who have resolved the issues with arrhythmia and palpitations and even the gut issues.
But also, I was trying to say the anxiety as well, the sadness, because on an emotional level, that part is connected with energy metabolism, but also emotions like sadness, not good enoughness, and, like confidence. So, but I probably feel like this is much bigger topic. I hear that you just wanted to set this in terms of gum inflammation, because that's one of the most...
It's a hidden inflammation you're not aware of.
Inflammation with the wisdom teeth, because a lot of people think that the pain is caused by the wisdom teeth, but it's actually caused by the gum around the wisdom teeth. And I think wisdom teeth is such a big topic that we're just going to keep more stories and
more attention there.
Even our experience and our clients' experience for the next episode. So,
some of the next episode.
So it's going to be toothpaste, which is going to be, what toothpaste, what we
topics,
what we recommend, like fluoride or not fluoride, definitely not fluoride. So that's going to be one, and another one's going to be about wisdom teeth. So now you know what's going to be coming up, and we can't wait to discuss that with you and share it with you.
See you in the next episode.
Thanks for listening, and remember that the best healer is within each of you. Take care.
Thank you for joining us on Healing Through Dentistry podcast.
We hope today's conversation has inspired you to see your smile as the gateway to whole body well-being.
To stay connected, visit us on our website or follow us on social media.
If you enjoyed this episode, please subscribe, leave a review, and share it with someone who could benefit.
Until next time, remember, healing starts with a smile.
Take care,
and we will see you in the next episode.